Bonjour. Good morning there. Mino Gajeb Kinawia, Bijikini Bawidishna Kaz, Mong and Dodem, Ojibwe Bodawatami Odawa, Anishinaabe and Dao, Kikwanang Ajordana and Donjaba, Ogima and Dao. Good morning there, everybody. Doing a community update in regards to COVID-19. Today is March the 1st, 2020. Haven't done a live video update in a while. I'm just sharing the community health centers updates on Facebook, but today warrants update live and let the community know the current situation around COVID-19. So Sonia Lambton had an uptake of cases over the weekend. We went back into the red zone 1 week ago today, and it's predicted that we'll be going to gray lockdown zone a week from now if the current spike in COVID-19 here in Lambton County keeps going up. Today in Kettle and Stony Point, we have 2 confirmed cases in the community, and there's a number of other people that have proved to be symptomatic over the weekend, which is quite alarming. So that's the situation in Kettle and Stony Point in regards to current confirmed cases. A number of people symptomatic, and also not a lot of testing. So over the past month or so, the majority of the testing at the health center has been staff that are on routine testing, doing their part to make sure they're not spreading the virus. People with symptoms, it's highly important that you get out there, take a test, and do your part in making sure that you know definitively if you have or don't have COVID-19. Jumping to the assumption that you have a cold or a flu or it's just a sniffle or a headache does not protect the rest of the community, doesn't protect the children or your coworkers or anybody you're associating with. So the current COVID cases, it's the understanding of the health department that this is community spread. Much of it's moving around undetected. There's been a few gatherings or events, so to speak, over the last week that probably have spread the virus around the community. So the school, based on information they have, the number of children that end up being contacts or contacts of contacts, it's estimated that likely greater than 50% of the children at Hillside have been in contact of a positive case. Staff members at the daycare have been in contact of contacts, and the protocols around this requires isolation and waiting for confirmation that your contact was negative, or for yourself to test negative after 5 to 7 days of exposure. So what that means is that the school, as a preemptive proactive measure to try and get ahead of this and stop the spread of COVID-19, has made the decision, based on all the information provided, to close the school beginning today for 14 days. The Head Start daycare will be taking the same precautions and will be closing from today on for 14 days. Much of the community program that was sort of appointment-based or with actual human interaction, person to person, is rolling back to virtual appointments. The band office stays at the status quo, where it's maximum 5 people in the building at any time, essential workers only, and the band office stays closed to the public. The high school buses, post-secondary buses, post-secondary students, that's up to your decision what you want to do, whether you're traveling back and forth to college or university or not, and how you're attending classes there. That's at your discretion. In terms of our secondary school students, for the next 2 weeks, buses will be canceled. Our education staff is reaching out to Lambton Kent District School Board and arranging for online education options for our students. So based on the community spread that's going on currently, school will essentially be at home for the next 14 days. Quite alarming for our community, and we want to get ahead of this and make sure that we do our part to stop the spread. So all those measures are still in place. Stay home, stay safe, make sure you're washing your hands and wearing a mask, essential travel only. And if you're having a hard time counting on your hand how many people outside of your household you've been in contact with, you've probably been in contact with way too many people. So keep that in mind as well. Vaccinations are coming to the community, though. It was confirmed today that we will be able to begin our vaccination clinics here for adult members of the community, like the sort of the first phase, which is frontline workers. It's first responders, people like that. That'll begin next week, the week of March the 8th. But there has been a mail out gone around the community, and there is about 10 pages of information there about the frequently asked questions, the pros and cons, everything you need to know about getting vaccinated. But the vaccination will commence starting next week. This is, of course, optional. And prior to being vaccinated, you need to sign a consent form. Those consents were mailed out. They are available on the social media site for the health center and the official site for the First Nation. You can get them from kettlepoint.org. If you don't have a hard copy in your mailbox already, you can get a hard copy by calling the health center and arranging to pick one up. Those consent forms can be returned to the First Nation by faxing the health center their confidential fax number, which goes into a locked office. That confidential fax number is 519-786-2427. The other option is you can call the health center at 519-786-5647, and you can arrange to drop off your signed consent form there, or you can scan and email it to the health center as well. So that's that around the vaccine and the current situation. If you're a community member living off the First Nation, of course, off-reserve members are welcome to travel to the community at a scheduled appointment time and be vaccinated. But if you're living off the First Nation and you want to get vaccinated in one of the major cities locally, there's an organization called SOHAC, and they do Indigenous healthcare off the First Nation. And they have, right now, I'm aware of 2 clinics running. They're running at the London Agriplex and in Mount Bridges. You can check their website or their Facebook page, SOHAC, SOAHAC, or you can call them at 1-833-927-0197. And you can arrange for an appointment to get vaccinated at the clinics in London through SOHAC. But of course, off-reserve members, you're welcome to come here and get vaccinated. So that's it. I seen on my chat here, I'll repeat it again for those of you that are in the chat, and I'll share this video to Wes to post on the official page later on. But post-secondary students, so those of you that are in post-secondary, college, university, things like that, it's your discretion on whether you're traveling to school or not. If you are in secondary school, the buses will not be running from the First Nation. We're not providing transportation to the schools. We recommend at-home, online type education for the next 2 weeks for secondary students. So that's it for my update today. Sorry for the sort of bleak news today that quite a bit of community spread here. So please stay home, stay safe, do your part. And if you have symptoms or you think you've been in contact with somebody, please get tested. We have nurses there. We have test kits. Get tested. Chimigwe.